Good evening. On behalf of Manochetna Academic and Research Center and Dr. Sharda Fatehpuria, our chairperson coordinator of the Institute. We welcome our coordinator of the event, Dr. Suvra Chandar, a well-known mental professional, and our distinguished panelists, health professionals who have joined as distinguished panelists, Dr. Shobboshachi Mitro, consultant psychiatrist, and Dr. P.R. Nondi, consultant clinical psychologist. From the field of education and the educators who've joined in from the higher institutes, Professor Shushmita Haldar, head of the Department of Psychology, St. Xavier's University. And we also welcome Professor Deboshri Banerjee from the Department of Education, Calcutta University, and also Professor Habiba Hussain from the Department of Education and Management, National Institute of Technical Teachers Training and Research. We welcome all attendees who have taken out time to attend our program today. Today's topic is impact of pandemic on the mental health of young adults, and we will also be looking for the way forward. After nearly 2 years of pandemic and 8 months of post-pandemic life and living, we need to look back and assess the impact of pandemic on our lives. This pandemic affected us globally. Children, young adults all were affected. However, for the sake of discussion and keeping time constraint in mind, we will restrict our discussions today to young adults. And also one thing we must keep in mind, the academic and emotional difficulties related to mental health that children faced were quite different from the young adults. So we will be concentrating again, I repeat, on the young adults. So it was also reported that about 27.5% of Indians between the age group of 15 to 29 years faced a lot of mental health difficulties. And also the State of the World Children's Report reported that 1 in 7 youth also felt depressed during the 2 years. Many are still facing academic difficulty and also mental health related difficulties. Some of them may be having difficulties like learning difficulties, communication difficulties, may have early stressors, or they may have lost loved ones during this time. We also need to focus on the young individuals, the girls who are of our country who have faced a very difficult times, especially those from the underbelly of our city and rural areas who faced the brunt of the digital divide, and also the worsening of financial conditions of the earning members of their family. This could be the sole bread earner, or could be due to loss, due to death. So they did face a very vulnerable time, and perhaps it is still continuing. We need to focus on them and look for solutions to help them. At the same time, I would like to say a few words before I pass on the responsibilities of the event to Coordinator Madam, a little bit about our institute. Manochetna Academic and Research Center has been working relentlessly for the last 10 years in the field of education and well-being of children and young adults. We are especially interested in finding new methods of teaching children and adults with learning difficulties, looking for new remedial methods of teaching them and empowering them, assessments, and also certification, and providing counseling help. And of course, we do and carry on lots of allied research work. Today's program is an intent of the Institute to provide support to the young individuals to build a beautiful future. Madam Coordinator, I'll call upon you in a couple of minutes. Before that, let me take the honor of introducing you. Dr. Subra Chandar, our coordinator of the event, is practicing as a psychologist from the past 35 years. She's also a psychoanalyst and cognitive behavior therapist. She's attached with Bodhodaya Mental Health Care, Bellevue Clinic, and Indian Psychoanalytical Society. She held position of General Secretary of Eastern Zonal Psychological Association, Assistant General Secretary, Lecturer and Course Coordinator of Indian Psychoanalytical Society, and ex-committee member of Indo-British Scholars Association, ABAC. And at the same time, I may add, with great honor and pride, I may add that Madam Coordinator has been our mentor for the last 10 years. Thank you, ma'am, and please take the responsibility of coordinating the event. Thank you.
Thank you, Dr. Sarkar. Thank you for this wonderful introduction of the event as well as of myself. So good evening, everyone. Thank you. First, let me start by thanking Dr. Sarkar and Manochetna Research and Academy for hosting this event and bringing up this very important topic. As Dr. Sarkar has already mentioned, the title of today's webinar is Impact of the Pandemic on the Mental Health of Young Adults and the Way Forward. Now, let me start with why this is important than other webinars, because there has been numerous webinars following the pandemic. Now, there are three important points, not because they have been stressed before, but because they have been mostly left out or not adequately stressed in other webinars. The three important points are mental health. Okay, we have seen that, what would I say, world leaders arguing, debating on many different issues. Health, of course, that was the primary thing, that was life and death. I wouldn't understress this point. However, as who has defined that health is not just absence of disorder, it's the well-being, physical, mental, and social well-being. So, under no circumstance can we understress mental health. But we found that this has been understressed. This was not adequately stressed, because without proper mental health, one cannot be properly healthy, especially given the situation and the circumstance. As all of us saw, very few reports were reported, and maybe a small few scattered reports, or in the media, in the print as well as TV media, I mean the electronic media, excepting for maybe a few mental health groups which focused, which brought up this issue, and and educationists, of course. So this is one very important point that we need to keep in mind, that mental health following the pandemic, it's not just health. Okay. Then the second point is young adults. Now, why young adults? And who are the young adults? Let me go by the definition of Erik Erikson, the famous psychologist, that young adults, according to his stages of the development, his ego-psychological state, young adults come between the adolescent stage and the middle adulthood. Okay, he gave it as 20s to 30s. But let us go by the electoral mode. So we will take maybe 18 to the 30s. Now, why this is important? This age group is important. See, there has been a lot of stress placed on elderly people, and rightfully. They have been the greatest sufferer during this COVID-19, 1, 2, 3, whatever the waves. Their problem has been taken into account. Children's problem has been highlighted. But this group, this young adult group, has been taken for granted. it is taken for granted that they would be able to cope with whatever is happening, not considering that this is a new situation, that they could also be very vulnerable, because they are come in this stage where they are not child enough to cry or share with others everything. They are not grown up enough to have the life skill to adequately cope up with the emotional issues that come up during this stage. Because this is a stage which is, as is again explained by Erickson, of affiliate formation, of intimacy, of developing life skills like profession. Okay, so many things are at stake which came to a standstill. So this is very important. Another important point is, most of the webinars or discussions have not stressed upon the way forward, which is very important. Because without this, without the light at the end of the tunnel, how do we survive? How do we show society that yes, there is something to look up to? Okay. So with this, I think this would be a very important topic of discussion. And we have a stellar panelist with us who would be highlighting all these points. I would like to start with Dr. Nandi first, by just introducing her, and then from she would take up. Let me introduce Dr. Priya Nandi. Welcome, please. Dr. Priya Nandi has done her PhD and MA in clinical psychology from the Indiana University, Pennsylvania, USA. She is attached as clinical psychologist with Medica Hospital, AMRI Hospital, and Apollo Clinic. She is partners in Parenting Inc., owner director, private practice, Johnston, PA, USA. So, but this is the formal introduction. However, during our informal discussion, we came across a very few interesting points that Dr. Nandi had to say, that she is in a very good position to give a comparative study of Indian young adults and young adults in the States or the West. Okay. So keeping all this in mind, it's a very interesting platform. Again, as I say, interesting point. I hand over the mic to Dr. Nandi. Please, you take over and give your well thought out discussion.
All right. All right. Thank you, Madam Coordinator, once again. And, good evening, ladies and gentlemen, and welcome. I am humbled to be on the same platform with esteemed colleagues, my seniors, and the panelists. Today, we are here to talk about the effect of the pandemic on young adults. We all know that COVID-19 has posed unprecedented stress to every generation in every corners of the world. But the desolating effect of COVID-19 have imparted mental health distress, especially on young adults. Mental well-being, we know, is just not only happiness, but how to handle stress and challenges that occurred during the pandemic. Young adults faced a lot of adversities, the fear of unknown, stress, social isolation, school closure, lack of structure and routine, which made them very lazy and socially withdrawn, that eventually caused severe anxiety and depression. We know how people are, especially the young adults. In the beginning, I saw that they want to make programs to visit on Zoom or Snapchat to talk to their friends so that they can see them during the isolation, during the lockdown. But slowly, that also decreased. They didn't want to come out in the public. They locked themselves up in their own room. In India, it was reported that 1 out of 5 reported depression and 1 out of 3 in America reported depression. The difference between India and America, I've seen that after the pandemic, when the lockdown was over, parents couldn't wait to send the children to school. But in America, we saw a gradual dropping, school droppings or school dropouts, especially among girls. And also the parents also didn't want to send the children to school because of financial stress. And the young adults on every sphere and every corners of the world face the same thing. They felt the fear, the loss of jobs of their parents, and also loss of loved ones. That created a lot of stress among them. When these young adults are forced to stay at home, they didn't want to communicate with anybody. They lock themselves up and they take refuge to social media. The internet usage I've seen have skyrocketed during this period, and the young adults were interested. They got hooked on pornography, which somewhat led to addiction, severe addiction, dropping out of school, and also stay at home was enough stress. And they really didn't know when everything will come back to normal. When they came, and the parents came, at the later, when in the beginning of pandemic, I could hear from my neighbor a lot of screaming, yelling, because parents are locking their children at home. They were not allowed to go out. But slowly that also decreased. Some parents complained that my children are not talking to anyone. They are just looking at the wall, and the majority of the time they lock themselves up in their room. Forcing children to stay at home, that did not enable them to achieve their academic achievement, and also physical well-being. Mental health and physical health, they're all interconnected. In America or in India, let me talk about India first. Wearing mask and getting vaccinated, it is very important. At least Indian people I've seen, they're very conscientious. They wear masks, and when vaccine was out, they flocked around the hospital, and there were long queues in the hospital clinic. And they couldn't wait to take the vaccine because they wanted to protect themselves and their loved ones. But in America, vaccines were wasted. They were thrown away because they didn't want to take the vaccine or wear masks. You would see number of rallies, especially the Trumpians. They didn't believe that the pandemic, COVID exists, and people don't need to wear masks. So you can see a lot of rallies with the posters said, we are not going to wear fear, or nobody is going to violate human rights. So in India, I could tell people that please wear your mask to anyone, as a matter of fact, even young adults. But when I was in America, my son told, don't wear masks, because it will be a big thing, big deal. Nobody wanted to wear masks. I could see in India, out of 10, 7 wore masks. And in America, I would be lucky if I saw 2 people wearing masks. And even, the young adults are very influenced. What is going on with they're very in tune with social media. When social media says it's not necessary to wear masks, they're the first one to drop. So what I feel as in America and India, there is a big social and cultural difference also. In India, people are very conscientious, and in America, they are not. They're very lackadaisy about doing things when they're asked to do something. But I know during this whole thing, the whole pandemic and the whole crisis, and so much crisis, I always tell that good things are going to happen, good times are going to come, and think positive, and there will be a silver lining to every situation. Thank you very much.
Thank you, Dr. Nandi. But can you just, as being a mental health professional, can you give us a few more detail, like apart from the mask issue, what other problems did you see among the young adults following the pandemic? It may not be just the state, a comparison, but what as a clinician you found to be the problems. If you could give a few more points about this. We would
Okay.
really, it would help us. Yeah.
Okay, I've seen the depression and the anxiety level has really gone up, and I've seen many people came for that. Parents brought their children, the young adults, to my session, and also the severe anxiety because they really didn't know what's going to happen. Will they ever lead a normal life? Uh, will they ever be allowed to meet friends or going out socially? So that was a big thing, and with depression, especially in America or even in India, with depression, suicidal rates also went up a lot. I've seen that. And basically the whole mental health field or mental health issues really became very important for to focus on these young adults, because we need to focus on these young adults, because they are the face of tomorrow. So if their mental health, if they have mental health problems, then the next generation will face the same thing. They will not see the brighter side. So mainly I have seen depression, anxiety, fear of the unknown. They show tantrums, anger outbursts. They didn't want to communicate properly with parents, and they refused to come out and even have a social even with family members, because they were scared, because maybe their loved ones died. I have seen a patient whose mother passed away. So for her, dealing with the pandemic, the social isolation, she had to deal with the grief and loss also of her parent. So that was a big thing that I faced during my counseling session during the pandemic.
Thank you so much, Dr. Nandi. But one thing I would just like to focus, because from my own experience, one very important thing that came up was abuse and dependence. It is both non-substance, like use of the mobile phone or a computer, laptop, that kind of thing, taking recourse to pornography and other kind of thing, and substance abuse also, sitting in their home. Nowadays, one can order drinks, okay? So taking to different kind of substance, I have found this to be one of the very important factors that is affecting young adults especially, and their families also. So what about you? Have you faced this kind of situation?
No, I did not face, thank God, that any drug abuse with my patients.
Okay. Thank you so much.
Thank you very much.
Thank you for a very nice presentation and a comparative study that you have given. We are really enriched by this. Thank you so much.
Thank you.
Okay. So now let me come to the next speaker. So now I would like to call upon, now I think one can see. So I would like to call upon Professor Shushmita Haldar. Why I'll tell that my justification for calling her after Dr. Nandi, who is a clinician, I'll justify that, but after I just introduce her, I'll give my justification. Professor Shushmita Haldar is an academician, researcher, and clinician. Currently, she is an associate professor and head of the Department of Psychology at the St. Xavier's University, Kolkata. She is a clinical psychologist. She has worked with leading institutes like Manipal College of Medical Sciences, Fortis Hospital, and Medica Hospital, Kolkata. Center for Studies of Developing Societies, New Delhi. She also worked with the Cognition Group and the Pearson Group in India. Welcome, Dr. Haldar. However, why I'm calling her is, I think she exactly belongs to the young, she deals exactly with the young adult group, people who are in college, okay? And she is also a clinician. So she would be facing a few problems arising from this group. So this is the reason I want her next to take up the mic and to give her observation and her problems that she observes. Dr. Haldar, will you please take up from here?
Yeah, good evening, everybody.
Good evening.
Is my video and audio is on?
Absolutely.
Yes.
Okay, thank you. So good evening, everybody, and thank you, Dr. Chandar, for a nice introduction. And I would also like to thank Manochetna for giving me this opportunity to talk on this very relevant and pertinent issue at this time, because we think pandemic is over, so probably problems are solved. But as an academician and dealing with the, especially that with young group, that young adult group, I would still call them children, that the effect or impact is immense at present if I compare between the during lockdown and post-pandemic time. So I would start from there, as she mentioned that I teach in a university. So I directly deal with this population. If I say that 18 to 23, 24 age group. And if I say so, and if my discussion would be in both ways, like during the lockdown, what happened, and post-lockdown, what is the impact? And definitely I will give more emphasis to the post-lockdown period, like when they are started coming to the colleges or universities. If I say that way, that though the topic is the impact on mental health, I would like to say that, see, not everybody is suffering from mental disorder during that pandemic and post-pandemic. Not everybody is suffering from severe depression, they are having that disorder or anxiety or panic or anything. But that doesn't mean that they are not having any mental health issues. So we need to understand that even they're not having any typical disorder, that they don't need to go to the visit the clinic, but they are doing well. So I think we should differentiate between this, and we should talk about in general what is the impact on the mental health. So if I start that way, that what I have observed, and definitely it is not about only mental health, it is physical health. We will not talk about it at least today's session. It is mental health, it is social relationship, and also the academic thing, which I will focus upon. And why I'm saying that these three are major things in their life, as well as they're interconnected too. You can imagine, well, if their academic is not good and their academic deterioration is there, definitely it is impacting the mental health also. Similarly, if they're not doing well in the mental health aspect, their academic will definitely deteriorate. So if I'm coming back to the typical classroom situations, I will give you some example, and I will not go into the mental health issues. Dr. Mitro is there to elaborate on those issues in the mental health issues, but I can give you some typical examples what exactly happening. So during lockdown, if I say that when they were doing that online classes, it was fun for them, trust me. Whoever says that they were suffering from a lot of problems, I would say not exactly. It was fun for them because it was online sessions. For teachers, for us, it was difficult times. We had to keep our cameras and voice on, but they were just switched off their cameras. They were doing other things, only getting the attendance. So that was the lockdown period when they were attending the online classes. But what happened after that, when they started coming to the real classes? So I would like to focus on those issues. So basically what happened, what we like observed after that 2 years of kind of that pandemic period, the lockdown period, there is a huge knowledge gap in their in their academic field. As well as I would just try to point out few things. Knowledge gap, when I say, it was that there are very good students were there. They were always very sincere. They were attending classes, but there are a majority, and I interacted with few that they said, yes, ma'am, though we were serious students, like we studied till 12 to graduation in a good way, but it affected us a lot when it was online sessions. And what the students said, so it's not me saying, or it's not a teacher or a mental health professional saying, but I am talking from the students' point of view. I would just like to share some their verbatims with you, that what exactly they said. They said, ma'am, there is a kind of, we are missing the real classes. Online classes are fine. You people are trying very good, but we are missing the online classes. Sorry, the real classes. So what they say, that missing that kind of offline classes, we are missing the real interaction. So that is their kind of verbatim they expressed. And they said these are the negative impact. So they said that no alternative to the physical mode classes. They said we missed the group presentation and that, kind of interaction after the classes. Also, they said that I deal with the mature students, so they could say all those things. They said that it is like we are finding error in the self-assessment. Self-assessment means that I don't know where I stand, because it's not easy to interact in the online mode, as well as we are missing the group studies. So that is from where it came, the verbatim that came. Then finally, what we found in the class, as I said previously, that there is a knowledge gap. Means when we started, say we started the master's group, we found that they're coming to the classes, that last 2 years they're doing online classes, but they're not being able to relate the thing. Don't think it's a very nice thing for them. It is frustration for us. It was very frustrating for them also. So because they're finding that yes, classes are going on, but we are not being able to relate the thing because the typical classes were not happening for last 2 years. And in the typical class sessions, what we said, the restlessness. Now they're reporting that if the class duration is 50 minutes, after 15-20 minutes, they started feeling very restless. They couldn't concentrate on that kind of classes. So this is the problem that we face, that restlessness, not being able to concentrate on the lecture. And they only reported that we are facing a lot of problems in that listening to your lectures and the concentration. So now if I summarize from their kind of reporting, I would say, I would again repeat, there is a huge knowledge gap in the group. There is a digital dependency, but probably Dr. Chandar wanted to mention that other than the substance abuse thing also, there is a digital dependency for both ways, because as adults also, we had to give them the mobile, the internet connection, and that laptop, that tabs to them for their classes. But we were not sure how good they were utilizing these things. But I understood that definitely they were studying, but at the same time they were utilizing those devices otherwise also. So there is a very significant digital dependency. What are the negative impact? Again, I'm not going into the detail on the digital dependency. There was an impact in there, and as I said, that this is connected, both are connected. Digital dependency, it was good media, digital medium was good during the lockdown, but that again impacted their attention. How it is, again, I'm not going into the detail thing. And one major thing which is finally impacting the mental health. So I'm trying to talk about that, how these issues in the academics is impacting the mental health issues. And finally, one more most important thing is the relationship part. They were, kind of restricted into their home situations, always with the adults. Some are definitely very sensitive, sensible, and understanding, but not all adults are very sensible to them. So they are kind of always fault finding, irritation, those things were there. They're missing their peer group relationship. They were missing that thing. So what happened post pandemic, and what I'm talking, it's nothing theoretical, what I observed in my class. They took time to maintain their relationship, developing their relationship with their peer group. They had difficulty with interacting with the teachers. Few of my colleagues, they complained that they are not giving enough respect to us. I told them that actually, what happened? They were not used to it in that last 2 years. They were missing that real life kind of interaction. So what I would like to say finally, that, academic point of view, many I found that they're losing interest. There are less interaction. There was less effective communication, which is indirectly impacting their academic thing, as well as that academic deterioration happened also. And it is also connected with their mental health. They felt irritated, they felt more anxious. Again, as I said, that if not anxiety disorder, but in most of the students, when first we talked about that offline exam, most of them were suffering from enormous kind of anxiety that how we will face that offline exam thing. So those things we noticed, and as a kind of academician, what we try to do in the class is to understand those issues, that the student is not being naughty when he or she is restless. Rather, it's the difficulty of that pandemic period that they are facing. So we need to be more sensitive and address those issues if we understand them. So these are few things I think academically, as well as that digital dependency thing, which is impacting the mental health problems, like kind of more mental health issues they face. Few definitely we referred for the more professional help, but many issues which are like they faced, we could manage as a teacher in the classroom setup, only giving some extra time, understanding their issues, being little more sensitive, and taking care of their issues sometimes personally also. So I think that I tried to say from my side, that what I observed in the typical classroom situation. Thank you.
Thank you so much, Dr. Haldar. It was really a very relevant, I mean, it's very real observation, I would say, because you have actually really faced this situation. So we can make out from your this discussion that what you have actually faced, you are sharing with us. So it is really very true what you have said, that they are not able to, they've forgotten how to interact, how to communicate. And too little peer interaction, too much family interaction, which is leading to, I think, a lot of family problem also. So yes, this fear of exam, these all things are actually, these are coming up, and they don't know how to face. And this is really, as you have pointed out, this is very relevant for young adults, because they don't know, they cannot go and tell that, okay, I don't know how to interact, I don't know how to interact with my friends. Okay, but this is exactly what is happening, and they don't know whom to turn to, to share their vulnerability. So they are turning to other means. So thank you. It is a very relevant points that you have raised for this age group with whom you are dealing. However, there is a question which I would like to bring up from the chat. Let us see. The question is, thanks, it's very interesting topic. My question is, how do we see the medium of social media impacting young adults? Because in some extent, it's being realized young adults were engaged in social media in making funny videos and earning through it also. Thank you for whoever has asked the question. So this is the question.
Yeah, thank you for the question. It's an interesting question, but I'm not.
Yeah, absolutely.
Interesting question, but I'm not very sure whether I can link with this particular thing, because it's a common question we can discuss.
Yeah, absolutely.
But still, I would like to answer. I would rather, if I try to connect with this particular topic, I think that exposure was much more where, we couldn't even control, because there are two ways things. Parents can't say, no, don't use, because in clinic setup also they say that we are forced to, because all classes are online. But as I said, interestingly, as an adult, as a clinician or academician, we observe that they are not always using it in a very nice way. Rather, I would say most of the time they are, doing it in using it in other ways. So definitely the exposure is more, control is less. And please don't take me wrong when I say control. Control means that there is no standard routine, they're not going to the classes. So because as I say, I tell my clients also, the parents, don't worry, when the schools or colleges will start, they will not get much time for all these things. So but during that time, there are a lot of time, they, in a way it was good that they didn't need to travel and all these things. But at the same time, there are a lot of free time, though we try to encourage them to practice some hobbies, engage into some active things. But honestly speaking, not everyone did this thing. So it is
Yeah.
more of a exposure. Second is lot of free time and less of kind of structured daily routine. So that led to these things. So in that particular period, I would say with changing time, now they are coming to colleges.
Proper limit setting is missing in some instance, I think.
Exactly. So now they are much controlled, I would say.
Yeah.
But still, I would say that digital dependency, it's increased and it is difficult to coming down. We need proper supervision, again, not the parental control, but supervision definitely.
Exactly.
Yeah, thank you.
Thank you so much. Thank you. Okay, so thank you, Dr. Haldar. As I've said once more, I am saying this. Now, next, I would like to call upon Dr. Debashree Banerjee. Again, I'll explain why in this order. Let me first introduce her. Professor Debashree Banerjee is an ex-head of the department and professor of Department of Education, Calcutta University. She has specialization in educational psychology, inclusive education, and teachers education. She has been member of different inspection team for academic and administrative matter of different colleges of Calcutta University. She has also been member of the PhD committee. She is also a member of disciplinary committee for undergraduate studies and ex-chairperson of the MPhil committee. So, welcome, Dr. Banerjee. However, why I'm calling you now is because you fit into the in-between period of not of the young adult, but of Dr. Haldar and Professor Habiba Hussain, I think, because you deal with students who are into post-graduation, into PhD, who are thinking, some are even into professions, okay? So, and they are considering settling down, getting married, joining a job. So it is just immediately after their graduation and in the post-graduation field, which is a little bit, they become a little bit responsible towards their family and themselves. So this is again a very important point which needs to be taken into consideration. And you, with your expertise in this field, I would request you to please enlighten us.
Thank you so much. And it's really nice sharing our viewpoints with all of you. Yes, I do deal with students who are at the postgraduate level or into research. And something unique about my university is it's a state-run university. So we have students from different socioeconomic backgrounds, coming from interior rural parts of the state, as well as from affluent families. So I find quite a lot of variation in my students. And when we are talking about post-pandemic period, there are quite a few students who have lost their earning members during pandemic. So now it has become their responsibility to run the family. Yet they want to carry on with their studies. And they have, all these days they were having their classes online. So it was more flexible for them. But now with during this period, when classes have started offline and exams are offline, many of them have stopped coming and they have left in between, because when we try to talk to them as to why you don't want to continue, we can't blame them, because they are not they are unable to manage the time, which was possible for them when it was online. They would maybe sit in the shops that they were working in and try to do the classes, and then again take notes from their friends. But some are still struggling very hard to carry on with their studies. So for them, it is quite a hard life. I know of two students of mine, one of whom works during the weekends as the night security in a hospital to meet his ends, he has to pay the fees, though our fee is very little, but then he has to buy his copies and again support the family. And he wants to carry on with his higher education. Again, there is another boy who works as a supporting mason, those jogare, to support his family, at the same time to support his own studies. Well, these are certain things which, as teachers, I believe we also have to take into consideration. Like maybe their attendance is a bit poor. They are having some problems in, coping with the class. They need more support from us. This wasn't the case before the pandemic. Like we had most of the students who were either studying, getting support either from the parents, or they were doing tuitions and little earnings from here and there. But now I believe it's nearly 25% of our students who are into this hard life. And yes, we have the similar problem of they're having this uncertainty of whether they'll be able to manage to remember the things, whether they'll be able to concentrate on whatever they are doing right now, their studies, and an uncertainty about the future. Because some have seen their family members losing their jobs during pandemic, and they really don't know what they will be into. So, this is the main problem which I find in our classrooms. And even, due to this pandemic, our academic sessions have been hampered a bit. For example, the PhD intake, even the students who were doing PhD who felt they would be able to finish it off. But as you know, in our subject, we have to collect data from schools and colleges, and they were having problems getting the data because of the close down. While some have been lucky because this online mode of collecting data has also helped them. They have started using Google Form. So there's again a positive side of the pandemic situation for them. They've learned how to collect data online, and it is helping them out too. But overall, we are having students who are having attention problems, definitely, problems of attending classes, and when we started off with our offline classes, people thought maybe it's a temporary thing that's taking place. Again, we'll have online and offline, and we'll be having blended ones. Now, for some students, getting into a hostel is getting difficult. So the cost of education has become too much for them. Traveling so much and attending the university. So the dropout rate has increased. And even if we try to tell them, like, anyway, it's just a small time span, we'll make it. In reality, when they are facing the life challenges, it is getting a bit difficult for them because, how to manage the time and going for education and think about getting a job when the job market is really very, very, very bleak right now for them. Because no matter how much degrees you have, you're not very sure as to whether you will get into any job or not. So they are giving a second thought to higher education. They are planning to drop out from higher education and maybe go into some courses which will fetch them some job. So this is the main scenario that I find in my institute, Dr. Chandra. This is what I felt I should share with you all, and if we could get some suggestions from the psychologists, the practitioners, as to how we can deal with them.
Thank you so much. It is really what you have said. It is really difficult. Some, they have lost their earning member, or even they were doing something, they have lost their jobs. I mean, many people, families, their parents have lost their job. So they have to supplement. What you have said is absolutely, absolutely to the point. What you have said, it's really a very tough time. But also, as you have said, it is not that they have only is the negative thing, but there are also certain positive points that they have learned how to adapt to this situation also. So one thing I am interested to know from you,
Yes.
Dr. Banerjee,
Yes.
is that, see, you deal with this, because I'm telling you, I deal with a different set of people, definitely, but what they have, what I see is that this age group, they think of starting a family. Okay.
Yes.
Now, young
yes.
adult, as I started by the definition of Erickson, this is the period of relationship forming, bonding, and affiliation. Okay. So many people during, say, PhD or things like that, they are into relationship. They think of starting a family, or if they are married, even some people are married, I know, they think of starting a family, getting, conceiving and all that. But I have seen myself in my clinic that they are postponing settling down because both of their jobs are not permanent, or not what I say. They cannot take the risk. Okay.
Right.
So they
Right.
are postponing marriage, affiliation, and even children leave aside. Even going out, because that means they say it is spending money.
True.
And in our society, what happens is you cannot take your partner to your home. Okay, parents don't allow. Even now, it is the situation. Let us face the thing. So, like, where can they go? They can't go. They have to spend money. They are not ready to
That's true.
spend money.
That's
So
true.
it is creating a rift, I would say, a distance rather, not rift, but distance, because they cannot consider all these things. So, do you
True.
also in sync with this? I would request you
Yes.
to
Yes.
shed a
Yes.
little bit light.
Yes, sure. You know what I found right after this pandemic, quite a few of my female students were married off, who were not really willing to get married. But then I asked them, how come you got married now? Then she said, my parents thought, like, I'll tell you, they come from a very, very poor socioeconomic condition. For those children, for those girls especially, their parents thought, getting a girl married off means at least they won't have to take charge of a girl, feeding her. So she will be fed by somebody, which we who are in the cities may not be very used to, but this is the scenario in the villages. So yes, that sort of things have also happened. And as you said, yes, especially the boys, they come and ask me like, ma'am, how many more years do we have to wait? Our parents expect us to get into something, get into a job and settle down. But we don't know the uncertainty. It's really hurting them a lot. And they are very confused.
Yeah,
They are very upset with the socio-economic condition.
yeah,
And quite a few are very depressed. Very depressed. They are very confused and depressed, and very naturally what happens is they tend to become very agitated.
yeah.
Lots of student unrest, I believe, is because of this. Have they been channelized in a proper manner? Have they had some hope
Right,
at the end? I'm
right.
sure this, because basically I find students are very, very, you can mold them a lot. If you can discuss with them, if you could at least let them tell you their pent up feelings,
Yeah,
lots can be settled down, but they don't know where to go to. And
exactly.
even we teachers at times are a little bit impatient. We expect too much from them. And regarding scholars, yes, that is a very, very, a trying phase for them, because parents start feeling, how many more years do we wait for you people to settle down? And for girls also, as you said, they keep deferring marriage,
Yeah,
and they keep deferring taking an issue, and then the other members of the family don't tend to realize why they are doing it. And especially in our Indian scenario, you know how the a female member of the family is
yeah.
treated, like she's too careeristic, and she doesn't think of the family. I have a scholar of mine who has gone through various mental stresses, and she went into depression, who's a very bright scholar, because of this pressure from the family for her to take up a child. And she's pretty adamant. She said, ma'am, even if I take up a child, I want a job before that. Like, I need to support, because I don't want to become one of the homemakers only after
Right,
studying so
right.
much. Yes. And what you said, it's very true in our university too. We do find students with this. And, what I can do at most is talk to maybe her family members if they don't feel me as an intruder from outside. But some may feel so, like I'm being maybe a little bit selfish and trying to, tell them, ki, let her finish off with her work, let her get into some job. But because they have their own philosophy and viewpoint, it is difficult, So maybe you all can help us out how to deal with such students and scholars. Right.
Thank
Thank you,
you so
Shubham.
much. Thank you so much, Dr. Banerjee,
Thank you.
for especially the case discussions that you have given, like the real life cases that you have brought up. It really helped us shed light and see actually what is happening with the situation. So thank you once again so much
Thank you.
for your enlightening discussion. Thank you.
Thank you, ma'am.
So, Dr. Arundhati Sarkar, Are you there? Would you like to say something?
I am particularly interested about the rural population.
I thought you had gone to sleep.
Can you hear me? Can
Of course.
Yes.
Yeah,
I was
please.
interested in the rural and the urban divide, the digital divide that impacted us.
Yes, yes.
And Professor Deboshri addressed those issues. And I'm also very much interested about what may have happened to the girls, the teens, the young girls. We know very young girls were married off, as I did not mention, but I'm so happy Professor Deboshri mentioned that, Professor Banerjee mentioned that they were married off so as to have one less mouth to feed. At the same time, we must say the challenges the parents are facing. These were extraordinary times. We faced extraordinary things were happening. But to some extent, I think that this goes back to the mentality that somehow has always impacted the girls of a society. I'm sorry to say.
True.
So, so it has only come out how the girls got impacted,
Exactly,
and how they suffered, and perhaps they're still suffering. I think their honest interest in academic pursuits also got hampered, even for the male students and the female students. But unfortunately, I tend to be a little biased in this, and also statistics shows us that girls, young girls, do get impacted more. Thank you so much.
Thank you, Dr. Sarkar. Thank you so much for your input. So now let me come to Professor Habiba Hussain. Let me first introduce her and then again give my justification for this order of sharing her views. Professor Habiba Hussain, welcome madam, is an associate professor in the Department of Education and Management at National Institute of Technical Teachers Training and Research, NITTTR, Kolkata. She has contributed towards the World Bank Research Project under Technical Education Projects IT. She is a life member of ISTE, AIAER, FOSCT, ISEC. So welcome, madam. Where are you?
Yeah, I'm here. Thank you so much. Thank you.
You're there? No, I've just before you start with your input, let me ask a few questions rather. I've called you at the end because Professor Haldar and Professor Banerjee especially brought up the plight and the conflict of teachers and professors. Okay, like in following the pandemic, yes, we are discussing young adults, but these have to be faced by teachers. Okay, so you deal with teachers training. So you deal with that population, that demographic group. So you are in a position to maybe enlighten upon this, this particular issue that comes up, and with a different age range. Okay, so I would request you to please give your enlightened view on this, to come up with your point of view.
Thank you, Dr. Shubhra. Thank you so much for that introduction. And first, let me thank Manochetna Academy and Research Center for giving me this opportunity to listen to all of you and also to share a little bit of my experience with the teachers. As Dr. Chandra already said, that I cater to teachers who are from engineering colleges, polytechnics, management institutes, and ours is a national institute. We train these teachers, so it's technical teachers we call. So that is NITTTR all about. Well, let me just get into I made a small presentation so that whatever I gathered from the teachers, those who come in our training, and of course, we have done a little bit of survey through our training programs, and I'm trying to share those. I hope I'm sharing my screen and I'm clearly audible. Dr. Chandra?
Yes. Yes.
Yeah. So the teacher's mental health, not exactly that everything is negative. Let me start with a positive note, what I gathered from the teachers, as also it's my own experience that there had been new learning. So technology, like say we have learned about the technology, and overcoming complexity, coordination, overcoming complexity and coordination. When I tried to understand from the teachers what they really meant was, like say post-pandemic we are discussing. So immediately after the reopening of colleges, they had to do a lot of adjustments, because they were in a different kind of environment where the office or the college was brought to the home, and from there they could do all the classes, managing quite well. Of course, initially it was a bit tough because suddenly we had to switch over to this technology enabled learning. But the positive side was that in spite of so many mishaps, that there was new learning at all fronts. So then coming to the next, that now in the post-pandemic, the teachers have at least 3 modes of delivery, means the classroom delivery that I'm trying to mention here. Firstly, the online is still there, and the offline, the majority is now offline, as also they have their recorded videos now. So those are also, some of the colleges have also been asked, the college teachers have been asked to go into this hybrid mode of learning. So they say that, ma'am, we have to put in more effort now. So this is because of these 3 modes of delivery that now they are trying to adjust to. So definitely there is a little bit of stress with the teachers, because managing everything and suddenly, you know, coming out of the home and then again going into the normal routine. So they have their own stress, the work pressure is there, then students not attending properly, they are still under that fear factor is still there. Then how to make up this loss, what Dr. Haldar was saying, that how to make up this loss between theory and practical, because they are dealing with technical students who would be professionals, who would be joining the world of work after their UG or after their PG. So the teachers find that their theoretical concept or the conceptual understanding has got a bit low during this pandemic when classes were online. So certainly this also brings in more pressure with the teachers, concerned teachers. Then anxiety is still there because they are coming out of their homes, and some are traveling with using the public transport system also, and their spouses or their children, they are also going to the office or college respectively, or schools. So that anxiety is still there with the parents, the working member or the teacher who is there. So this is another factor that is affecting their mental health. Of course, loss of near and dear ones, because now they say that, ma'am, when we are in the common room and we are meeting, there is less of academic interaction. Initially, there was, when the college reopened, less of academic interaction, more of colleagues meeting together, more of these things, that what happened and who is following or who is having what problem. Similarly, this was happening with the students also. So teachers very much concerned with students, they also felt the loss, their loss as their own loss. That was there. Then making students feel at home, this has come as a challenge to the teachers, because students, you see, they are always loving this technology, and they very much like to have gadgets with them. As it is in their offline classes prior to pandemic, students were restricted that you cannot bring in your mobile phones, even if they carried somehow, hiding in their bags, they were not allowed to use it in the class. But now it has become almost mandatory. So they are using it in their class, but at the same time, teachers feel that, okay, this can be used in a positive way, like say, let us do something using technology in the class, how it can help in learning. But then making that feel, when they are in a brick and mortar classroom now, making them feel that feeling of the class, they say, ma'am, it's still a challenge for us, because they cannot sit for long hours. They feel that it's okay, ma'am can give us online like she was doing earlier. So they are demanding more of such kind of sessions from the teachers. Then we have older teachers also, those who are senior by age. They still have this fear of technology. Not all of them, but many of them. And some of them do not feel that free to learn from their young peers. Some of them, of course, are learning. So this is another factor, that whether we'll be coping up with this or not, though the offline classes have started now. Then difficulty being faced in offline class, particularly for the teachers. See, this is related, a little bit related to physical, which again is having some impact on their mental health, that now they have to again stand for 1.5 hours or say 2 hours in the practical classes. At least 1 hour they have to stand and take the class, which was almost stopped for 1.5 years during this pandemic. And the vocal quality, that throw of the voice, the loudness with which they were speaking prior to pandemic, somehow they didn't do that during this online classes. So adjusting from prior to pandemic, during pandemic, and post pandemic with the vocal also, that is another problem which they are facing, and they are trying to cope up. Then speech problem with the mask on. So they were again having fear whether I should open it and then I speak, but they have to, so that they are clear in their communication in the class. Then managing both fronts, some teachers say that it's a lot of exhaustion, almost at the brim of burnout, managing home and managing. Then some of them are still worried about a new variant of virus. That's what they said, that suddenly we are hearing this monkeypox, all these kinds, or say this booster dose doesn't work because this mutation, this is a lot of mutation going on in this COVID-19 virus, etc., etc. So these things are taking a little bit of toll on the mental health of teachers. Now I'll come to their observation, the teacher's observation about their students, which again is very significant. So what they told me that, ma'am, the first thing is that when our students came back after the pandemic, they said they felt that they are breathing freedom, air of freedom. They were feeling so good. At the same time, some of them were extra cautious. Like you see in our family also, we have like some members are extra cautious, some are just carefree. Okay, we'll go without mask, nothing will happen. So many people are not putting on masks, like what Dr. Nandi was telling. So these things were also being observed with the student group. Then they are more glued to laptops and mobile phones. Hence, as I showed you in my previous slide, that making them feel at home in that brick and mortar classroom is again quite a challenging task for the teachers. And they are demanding more of notes, online assignments. So everything let us do online, and let us cut short our classes offline, the face-to-face interaction. And the attendance has been low. I visited one college recently, an engineering college, and they said that I could feel that it was very less populated with the student population. Teachers were coming on, but the student population was low. And they said that, ma'am, they are still fearing that these things will happen. And some, of course, they are restless at home and they come, but others, they still don't want to come, and they like to have this online classes still. And library and canteens, there is less footfall. So the reading, the writing, particularly the reading part has taken a back seat now, because they want more of notes, more of online assignments. Even they will just take a printout of the teacher's notes instead of writing what they used to do prior to this. Now, teachers' observations about the student behavior, that they feel a bit of, some of them feel aloof, a feeling of disconnectedness is seen in some students, not all. And some students had financial problem, as Dr. Banerjee was saying, that the earning member perhaps passed away, but majority what the teachers observed was that they lost their job. And so this boy or the girl, the student had to face this financial problem. Somewhere they had been helping with small 1 or 2 occupation somewhat But then this is really something vital point for them, a crucial point, a challenge for the students. And due to this, particularly in the northeastern states, we get teachers from all over the country. So the northeastern states, some teachers, they shared this, that this substance abuse that has been so rampant with the students again, because of all these domestic violence. Again, the mother is being beaten up, or the children are being beaten up just because of these financial problem and all. So that is another point. Then students lack motivation because of all this, the motivation to come to the class, the motivation to sit long for longer hours like earlier they used to do. There's a big question on skill development of the students, because during this pandemic, the
Excuse me,
lab,
I'm so sorry to interrupt you, Dr. Hussain. But actually, we are running a bit short of time, and the 10 minutes are much ahead. I mean, it's
okay,
over.
I'll just
12
close
minutes.
now. I don't have
But
any.
we are at a very interesting point. I know what you're saying.
Yeah.
But I'm very
So
sorry.
during this, yeah, I'll just close. During this pandemic, the lab sessions were not there, though with virtual labs they were doing, but they couldn't do, and they were feeling less confident. That is restlessness, as I told, the anxiety over exams, because now they don't want to take offline exams. The mentor-mentee relationship in some of the colleges, the teachers are the mentors. There's a formal mentoring session system is there. So the teachers felt that the mentor-mentee relationship somewhere has been hampered. Three typical problems were faced by the teachers, as you can see. More serious, some students felt a bit depressed, some had to take some counseling, and the fear is always there. The less serious problem being faced with the student was their inattentiveness in the class, disruptive fiddling with the mobile phones, etc. And minor nature was that they are not very punctual in the classes. So these are the observations. But I think with this forum, there is a ray of hope, because we will get to know what is the way forward from all these experts. So once again, I thank MARC. Thank you very much.
Thank you, Professor Hussain, for highlighting very important points. In fact, I have got a lot of observation to make, but I won't, because as I said, we are running short of time. So this is really, really what we have said. In fact, one point I would like to just focus is that I'm having a lot of many teachers who are coming to me following the pandemic, because they cannot, as you have said, there is an age difference. I mean, age range, there's age divide. Okay, like young teachers, they are able to cope with the new technology, the new way of living. But the more older teachers, they are not able to cope up. They are suffering from immense anxiety and to some extent panic disorder. Even if not disorder, I would say at least from panic attack. Okay, because they are having to face certain situations, especially of this age group, where the students are quite grown up and they can make out, okay, the teacher is not comfortable, where ragging of the teacher, or I would say teachers feel less confident. So this is one very important point, that teachers are feeling very vulnerable, not only the students. And I have at least quite a few number of teachers who are coming to me for help. So this is one thing, but anyway, many points you made are really very relevant, very important. Thank you once again. Thank you very much for your observation. So now we have few questions actually. We have got 3 questions, but I think I would request Dr. Mitra first to give his presentation, and then we will take the questions so that the time can be maintained. Okay. So let me introduce Dr. Mitra, and we are looking to him. End of the tunnel, he is there. So Dr. Sabyasachi Mitra, he is a very well-known person. Needs no introduction, but anyway, it's a formal thing. He graduated from Calcutta National Medical College and completed post-graduation in UK. He became consultant psychiatrist in Liverpool and was lecturer in clinical psychology at Manchester University. He is practicing as consultant at CMRI, Bellevue Clinic and Woodland Hospitals. He is presently associated with various print media and television channels as advisor and participant in talk shows. We get him every evening actually in our rooms. So most people would be knowing that. So it's all yours because we are all helpless and we are looking to you to solve a problem. And we have got quite a number of questions which I would then bring up. So it's all yours, Dr. Mitra.
Thank you very much. Ladies and gentlemen, a very, very good evening to all of you. I firstly have to thank Dr. Shubhra Chandra for, suggesting my name that I would be available for this discussion. I also start off by thanking Manochetna and Dr. Arundhati Sarkar, who allowed me to be a participant in this program. And I think it is a wonderful program. I mean, of course, we have learned so much from the educationists regarding the problems that have been faced by students during the pandemic. But I have been interested with the discussion to take forward the discussion, which would deal with what next? How do we proceed from here? And to be honest, very, very honest, I'm very, very positive as to how we are going to proceed from here. Because deep down, I think, we really needed something of a pandemic to actually jolt the entire world into a new world order. And that is exactly what is happening now. We have had a long, long time of stagnation, perhaps for half a century, where nothing really, we wouldn't wish a war or a famine or anything. But obviously, with all difficult times comes different times which follows. And this is exactly what is going to happen. I'm going to be a very, very positive guy this evening, because I think pandemic has done us a world of good. Because if you talk about artificial intelligence, machine learning, online, these used to be coming in kind of geographical areas or financial areas of seclusion, of islands of excellence. They were coming into renowned colleges, they were coming into the homes of richer people. And I think that has been demolished by the pandemic, and that there has been some sense of uniformity. So there has been an improvisation on this stagnation. And let us think about, the basic things that, like cleanliness. We have learned much more about it. I think most of us had lost an idea as to the fact that we needed to be clean, we needed to wash our hands, we needed to think what we eat and what we drink and how we lead our lives. But that has come back. Let us talk about the health infrastructure. There's been a pan change in the global health infrastructure following the pandemic. So we are in a much better position to deal with most adversities of life. And that is, believe me, ladies and gentlemen, that is global. It again used to be in islands of excellence, and that has been crushed down. And we are having a much more equitable distribution of infrastructure of health. So we are talking about, if we are talking about hospitals in West Bengal or in Kolkata, or, there have been developments in the rural hospitals as well, as to deal with medical emergencies. And these changes are here to stay. They will usher in a new era. This is the first time in the last century that a vaccine could have been invented in 14 months of pandemic. Believe me, ladies and gentlemen, this pandemic would have killed 10 times the number who have already died had we not been so active in finding out the vaccination. And in no other pandemic, a vaccine has been so early detected. We have also changed sociologically as to having an empathy. We have for other people. We have understood, we have started respecting work, education much better than before, where we used to take it for granted. You see, if you see the financial growth of post-pandemics, there is usually a V curve or a U curve. So either when the finances have gone down sharply, it comes up sharply in the next 5-7 years, which is called a V curve, or at the worst, you can have a U curve where the improvement will be over the next 10 years. Professor Shushmita Haldar was talking about new skills have development. Yes, that little child who is making funny videos, he has learned a new skill and he is actually earning money out of it. That is a positive side of pandemic, and that is the future, because all these things, all these changes which were urgently needed had come on backdrop of the pandemic, and it has come in an urgent fashion, which would have otherwise taken 10, 20, 30 years to evolve in the society. So that little child who is making funny videos has in the process learned a lot of new skills, and all of us have. I'll give you an example from my life. I used to be quite averse to online stuff because of my age and my generation, but the pandemic had actually forced me to learn seeing patients online, and I do that so wonderfully these days, which is unimaginable. But believe me, ladies and gentlemen, online, be it in whatever format, is going to be here for the rest of our lifetime. Whether we like it or loathe it, we have been forced to accept another way of life, which is the online way of life. And many people, I'm giving you my personal experience, where many patients are actually unwilling to come to hospitals and would prefer to see me through this screen, sitting at the comforts of their homes. So we have doctors as physicians, as doctors, as I'm sure psychologists, we are having no other option but to keep that option in hand too, because there is a significant number of population who have actually switched on to the online mode and are very, very reluctant to embrace back the physical mode that they have been using so far. There is also an important issue about the government spending GDP, part of the GDP behind education and health. I hope if our politicians don't get any worse from here, then there is a global realization that much more needs to be spent with education, much more needs to be spent with health infrastructure, rather than procuring arms and, hitting other countries with missiles. So there will be, the way forward will be a huge change in where you put your money. As they say in English, that you put your money where the mouth is. So I think the shape of the mouth, the concept of the mouth, the needs of the mouth has changed in this pandemic. So we will have more investment in areas which are more important, like education and healthcare. So as I'm supposed to be talking on the way forward, it is important that the way forward needs to be on various aspects. We have to talk about education. We have to talk about the social way forward. We have to talk about the financial way forward. And of course, we have to talk about the mental health, mental and the physical health forward. Way forward. So what about the education? What do we see in the future? I personally, while I was listening to all of you, I personally coined a term. I'm sure that is never going to be used after today, but I firmly believe that it would be a tri-brid situation, where we know of unibrid, where the students in the last 100 years, they used to get up in the morning, brush their teeth, take the bus, go to the school. The teachers used to come, they would teach them. And so there was no evolution of the educational system. And slowly, as I said, richer people, colleges with more might and right, they started having online. But I think this was hybrid, what we have experienced. But in future, what we are going to see is a tri-brid situation where the students would enjoy coming on site and doing the classes, but the teachers and the students would enjoy interacting with each other through online modalities of treatment, because it will be fast, it would be furious, it would be effective, and it would be easier for the students and the teachers. So why would the students come to the school? Because they don't come to school only for learning, only for education. They come to meet friends. They come to play. They come to be naughty. They come to learn the things that parents don't teach them, but it is important to learn. So they will be physically attending school, and an online classroom will happen on site. I call that tri-brid. So these things will happen. So the future would be back to schools and colleges, but it is important that every student is vaccinated. The schools and the colleges and the parents taken the onus on themselves to vaccinate their kids whenever the government is asking them to. So we have to make up for the lost education. It is also important for us to mention over here that the teachers would have to do retraining, and they will have to support these students and their family members. Because many, as rightly pointed out by my previous speakers, that many of the families have lost jobs. Many of the parents are unable to learn skills, so they will slowly get impoverished and wane out. So it is also important it would be important in the future for the teachers to train the parents to actually, help their wards. Special support would be needed for special needs population. That is very, very important, that we must not lose out our focus by focusing on the normal kids, that there is a huge number of students with special needs, and we need to focus more. We need to give them extra classes. We need to make sure that they are becoming, a part of this hybrid or tribrid model. So it is, safe practices needs to be followed. And what about in that case, as we have, we are short of time, so we have to kind of go forward. So what will be the social way forward? One is vaccination, vaccination, vaccination. That needs to be updated. Safe practices, you should not let go of your safer practices. You please restart with your social interactions. যেখানে আড্ডা মারতে যেতেন সেখানে যাবেন, যেই টিউশনে যেতেন সেখানে যাবেন. Whatever you used to do pre-COVID, you should do them doubly over after the COVID, now that the COVID is slowly waning off, because you need to relearn. Because what has happened as a society, not only kids, adults, adolescents, elderly, we have all lost our skills, the inherent skills which socially was entrusted on us, which we never thought that were important because it would come to us automatically. We have lost those skills, and hence we have to relearn those skills. How do you relearn those skills? Is to do the things that you were doing in the past with a vengeance. Do it doubly, trebly. If you were to be going to a restaurant once a week, try and make it twice. So we need to learn these social skills again, but again, within the realms of safe practices. It would be socially very important to be mindful of the deaths and the disabilities which the pandemic has left various families. So be very, very empathic as to the way you carry on in front of them. That is the way forward. Please go ahead with the relationship issues as well. Many of the previous speakers were talking about relationships. Yes, that's the core, pillar of human living. So be romantic, be non-romantic. The relationships need to start. They need to start. They should not be put on hold, because that is the way forward for humanity. With regards to the financial way forward, it is going to be a tricky situation, because the pandemic would actually wipe away many of the industries. The pandemic would usher in many types of industries. So for the adolescents of today and the teachers, they need to sit together. And educationists would play a huge role over here. They need to sit together as to find out and identify what are the needs of post-pandemic era, because there is no point in going and studying something which will not lead to a job, meaningful job, or adding another member of the earning member in the family. So it's important to identify the areas of jobs that will grow, and learn new skills, go for courses, and get yourself ready for those sectors. That's very, 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 very important, because all sectors will now pave way for the newer ones. Jobs will be there, but in a different shape, in a different form, in a different color. There has been salary cuts for parents. So this is the time for austerity. We have been on a treadmill which was running at a speed of 17. The pandemic had suddenly stopped it. We cannot restart at 17. This is the time when people should be careful about their money, because what is happening with the pandemic, a financial inflation has set in already. And as a cycle of economy, what would happen? This inflation would necessitate a recession. which is about to come into the West, and India in the very near future will not be left far behind, because I presume in the next half, in the first half of the next year, perhaps we might go into a financial recession, because Europe is already going in, and so will be followed by America, and India cannot be left behind. So this is the time for financial austerity. আগে 100 টাকা 200 টাকা 500 টাকা 1000 টাকা হুটহাট খরচা করে দিতাম, মানে you shouldn't be doing that now. It is the time to lie low and let the dust settle first. So it's very important. It is also very important for the adolescents, which I say is that there will be a pile up in the job market, because what has happened, my son has experienced it. What has happened is that the graduates of 20, the graduates of 21, they have not yet got the job. So there is a pile up. So the graduates of 23, 24 will have to face a hurdle, an extra hurdle. So prepare yourself for that. If you are prepared, a young man who is well prepared is well versed and sure to win. So that's the way forward in the financial sector. Now, lastly, but not the least, what do we do with what is the way forward for our mental and physical health? Because as Shubhra-ji has suggested, there is no health without mental health, and we are not focusing on physical health today for various reasons and for the paucity of time. So I will quickly go through kind of 5-6 points, which is regular exercise, good food. Go back to your regular exercises. If you are walking to your office, start doing that. Slowly cut down. People have got addicted to alcohol and substances because they had nothing to do in the evenings, and the only thing that they would resort to would be a glass of wine or whatever different substances, or smoking. So it is the time now that the world is opening up. We are having more confidence in our abilities to deal with the pandemic. This is the time to cut down on your substance abuse and your alcohol. And we were talking about addictions online. Yes, it is preferably called screen addiction. It is important that over here I would mention a small, sentence over here, that sometimes parents say, "Oh, ami to amar cheler bondhu." No, they have enough friends. Try to be a parent. Parented job description, teacher job description are very different from a bondhur job description. So don't infringe yourself into another job description and start doing, "Oh, I am a friend of my son. I am the best friend of my daughter." That's fairly stupid. It should not be done. Be a parent. Screen time should not be more than 2 hours. It is categorically proved that it does more harm to your brain if you are addicted to screen, doing whatever good thing, bad thing you are doing. So restrict your screen time. Parent should have a control on their kids, what they are doing, what they are not doing, because there are chances that you might be, predators are waiting there and you might be abused. So very, very important that teachers should be teachers, doctors should behave as doctors, and parents should behave as parents. So please, for heaven's sake, slowly reduce your, screen time. Get into in-person socialization, exactly the way you used to. So forget your screen. It is important. It is here to stay. We understand that. You also know that, but do it within limitation. Otherwise, do what a human being, your body is supposed to do, your mind is supposed to do. Go for in-person socialization. Help others with depression, anxiety, substance abuse. And you need to know the telltale signs of depression. Otherwise, I would have loved to talk about those. So find out, Google, what is the telltale signs of depression? What is the telltale signs of anxiety? What are the telltale signs of alcoholism? And you have 6 or 7 lines to memorize them. And if you have a friend who is having these problems, please go and help. It is for your time to stand next to somebody who is suffering and help him grow as you are growing too. So rebuild relationship. Rebuild support your peers. And also remember, I will end this topic by saying there is a looming concept of long COVID, where people are suffering for longer than they should. People are suffering with physical ailments like heart and lungs and brain also than they should. So it is well beyond 1 year after you have had COVID. So take care of yourself, take care of others, look into the aspects of long COVID, live a very healthy life, and that should be the way forward. I see a bright light at the end of this tunnel, and our world will be a very differently rejuvenated world if we have the right attitude towards it. Thank you very much. Thank you, ladies and gentlemen. Good evening.
Thank you so much for your enlightening presentation with by presenting a lot of hope and light at the end of the road, because we were really losing hope that okay, what is to be done, because as predicted that although the pandemic might end in fourth wave, fifth wave, but the effect would be continuing for decades and decades. This is what is the prediction from the World Bank and others. So yes, we were thinking that there is no hope, nothing good has come from the pandemic, it is only negative, negative, negative. However, what you have pointed out is that we had perhaps taken everything too much for granted in life and society, so to say. We must learn to again start respecting many different things, like our health, our physical and mental well-being, people around us, our family, our friends, our money, new skills, quality time, interaction, and everything. We were perhaps losing respect for all these things, to which we again need to wake up and take notice of all these things. Also, another thing I think is that it is not that everything is lost. We are learning new skill. We are adapting in a new way. It is not, okay, the old order has gone, but that doesn't mean that we cannot adjust in a new manner. If one kind of job has gone, there are many different kind of job that has been generated. Like I'll just give you a small example. I know people who are working in office, but they are now previously delivering, thing was certainly looked down upon. I know people who has got a bike and they just then put up the sticker of Swiggy or Zomato and do that extra time, okay, along with their regular office job. So they are learning to adapt. In the morning before going to office, they are doing the moto bike kind of thing. Ola and Uber, they do that moto Uber. Okay, so if people have lost job, people who are ready to adapt, they are also picking up different skills to do. Another very important thing, which I think Dr. Mitra, you'll agree with me, you never did housework before the pandemic. Okay. So now there was this divide, women will do the housework, men, they will go out after coming back from office, they will sit on the sofa, put up their feet for the wife to bring the cup of tea. Now, wife will say, you go up please and get the cup of tea and give me one also, because I have got so many other things to do. Because with lack of domestic help, this divide of I will work, what I will work, all this thing is gone. And many people, many men I know who have learned the new skill of cooking. They have developed this interest of cooking, how to cook, and now they are enjoying all this. Okay, so I think, as you have said, yes, there is a light at the end of the tunnel. It is not everything is dark. So thank you again so much for showing us, okay, there is hope at the end of the road. That is one thing, but I would now open the discussion to a few questions. We have got about 10 minutes time. There are 3-4 questions. I'll take those. To everyone, I am pointing that out. Just a minute, let me read out the question. How we can propose teachers or young adults counseling in post-COVID time at institution and non-institution level? This is one. Another is, I would submit that the discussion would be more meaningful if we could focus on the stress faced by youngsters on account of COVID crisis and the curtailment of mobility, strain of online classes, and sense of feeling crowded in the confines of their homes. Okay, another thing is how mental health of young adults can be addressed at educational institutions in the post-COVID situation. Are they ready to accommodate smoothly in academic environment? So these are some of the questions which I now ask along with Dr. Mitra, Dr. Nandi, Dr. Banerjee, Dr. Hazar, and Professor Hussain to please answer these questions that has come up. Yeah.
I think, you know, if I'm allowed to answer the first one.
Please go ahead.
See, somebody had asked that, you know, whether, you know, how do we send kids for counseling and everything. One very important issue over here is that mild to moderate mental illness does not need major treatment in adolescence. You know, they can actually talk with their peers and come out of it. It would not be a right way forward if we actually send everybody for counseling, because these are natural calamities which require natural timing or to heal and natural, you know, support system. That is the reason why we have friends. That is the reason why we have families. That is the reason why we have schools, you know. So the normal interaction, once all these adolescents, yes, I think I will amalgamate too, where the confines of the home had actually been like a pressure cooker for them. Okay, because see, at the end of the day, school is somewhere where you can be naughty and not be judged. Quietly, you can be naughty. The smarter students can be quietly naughty and not be judged. I love them because they can do these things in the safety of the schools. That is the place where Ami Chotobala khub badmash chilam, and I really wish I could go back and do those things again. But
I was about to point that out. That are you identifying with this thing?
Of course, you know that better. So what happens is that school is a very, very safe place for the kids. And they were put into a pressure cooker situation in front of the 4 eyes of their parents. Who would enjoy that? I wouldn't. My kids wouldn't. So once they go back, it will be a natural inherent tendency, once you go back from the pressure cooker situation, to actually have your wings and fly. And that itself will be remedial for most adolescents. Yes, there will be a certain proportion, which thankfully is always a minority, where you need counseling. Even lesser number of people would need
that is a clinical group. I think counseling
That's right.
for clinical group.
Yeah. So
not
if
for everyone problem.
If somebody, as I was talking about the telltale signs, if somebody is completely not socializing, is tearful, is suicidal, is harming herself or himself, is, you know, always very, very negative, and you know, he is not eating, his self-care or her self-care is very, very poor, then you send them for counseling. And if that doesn't resolve the issue, then you send them to the doctor for treatment, for medical treatment. So I think amalgate the first and the last question. I totally understand these two questions are very, very important. I think the cure is inherently built by coming into school for most. For the minuscule population where they need therapy, these are the telltale signs and they need to go for therapy. And the therapist decides whether it is time for medications or not.
If I may...
one important point. Okay, sorry. আমি একটা শুধু কথা বলছি বলছি এক মিনিট to Dr. Mitra's কথা আমি একটা I would like to point out one thing. You said that within the confines of the 4 walls of the family, which creates like a pressure cooker situation. But is it not also true that families are now having quality time which they were missing previously?
See, it cuts both ways, because many of the families, the quality time has become so much of a quantity time that, you know, the number of divorces have gone up. Number of conflicts within the family has gone up. So I think it is, see, this is what the COVID has taught us. This has also taught us the importance of the 4 walls, the you know, responsibilities of home living, the importance of going out and having a non-family time. So there has been a huge level of realization for the population who wants to realize. So it is, you are absolutely right that there has been, for many families, there has been quality time, increment of the quality time, but we cannot forget those families where that has come not as a blessing, but as a curse.
Okay. Okay. Dr. Nandi and Dr. Haldar wanted to say something very quickly because we have got just 3 minutes left for vote of thanks. And
I just made one point because exactly, yeah. So I just wanted to say the same thing what Dr. Mitra said, that it would be the counseling process would be in the 3 levels. First of all, it should be encouraged in the discussion with peers. It should be the peer group discussion. We should not. Rather, what's happening nowadays, because they are also very much aware because of media, because of the discussion, there are mental health issues. They directly come to us with the diagnosis by themselves that I'm suffering from this PTSD, anxiety disorder, to the extent of PTSD and depressive disorder. So we should encourage. First level is that no, because others are also suffering, others are also going through this, and in any level we should encourage that peer group discussion. I think the second level is any good institution, it's a school, college, university, little privileged institutions I'm talking about. There is a counseling cell also. The second level they can we can send them, because again there could be a good discussion. They can give examples of others. They can go in a group or individual session. And finally, we should talk about that sending to that clinic setup or to the mental
professional setup. Yeah.
So here, as I said, as a teachers, as an academician, we should be little aware of. Students may not be aware of that. What are the signs and symptoms? What Dr. Mitra mentioned, that we should. Now we should, yeah. These I think that very important. Yes.
Thank you so much. Thank you so much. You please thank and
Thank you so much. Thank you. Thank you for the wonderful coordination and making the program lively. Wonderful delivery by all the erudite, delivery by our panelists. Thank you so much. And what a wonderful way forward. There is ray of hope, and this makes us hopeful. Thank you so much. Thank you to all of you. Wonderful contribution, and almost all our questions were answered. Those who could not get in today, the program will live stream, and the recorded program will also be there on YouTube and Facebook. Please post your questions on the social channels, and the questions will be answered by the professionals and the panelists who attended the program today. With the final word from Dr. Nondi, perhaps? Dr. Nondi?
Can you see me? Can you hear me?
Piyadi, Dr. Nondi, we are a bit sorry.
Can you hear me now?
Yes, please try.
Can you hear me?
But the program can stop.
Can you hear me now?
Please, yes, we can hear you. Please continue, Dr. Nondi.
Acha, আমি যেটা বলতে চাই যে schools, if the schools can arrange workshops so that the clinicians or the professionals can go and train them in public, so nobody is individualized or labeled that, oh, she has mental health issues, she has to go to the therapist. But if we do workshops, then we can reach the larger population. That's all I have to say in continuation with Dr. Moitros.
You're talking about awareness.
Thank you very much.
Important. Thank you so much. Such pertinent questions answered. And I think almost all our queries were answered today. Few left out, please address on the YouTube channel or the Facebook links that are given over there. I'm sure our experts will be happy to answer your queries. This was addressed to the attendees. Thank you again to all of you. We are very grateful on behalf of the Institute for addressing this important topic so beautifully. Your support is much appreciated. Thank you so much. I don't have time to address all of your support individually and name you again, but I will also thank our coordinator, the panelists, our chairperson emeritus, as well as the coordinator of Manochetna, in charge of Manochetna, and a technical team who supported us. And not to forget the attendees who took out time to attend this program live, but don't forget the attendees who will come in to watch our program later on the YouTube channel and Facebook. Thank you so much. Thank you. Thank you.
Thank you.
Coordinator, madam, last word from you.
Thanks everyone, especially Mark and Dr. Sarkar and all the panelists. Wonderful job. Thank you so much.
Thank you. Thank you so much. Your support is very, very appreciated. We could not have done it.
Thank you. Thank you.
Thank you.
My pleasure. Thank you.